Good morning. My name is Eric Ream, and I lead the benefits operation at Seubert Associates. Seubert Associates is a privately held insurance consulting firm with primary disciplines in property casualty, surety bonds, personal lines, and human capital risk. Over the past year, we all had to learn about the virus implications on our business. And then recently, we optimistically waited for the vaccination rollout in hopes of some kind of return to normalcy. Today, Seubert Associates and Dentons Cohen Grigsby will address coverage-related and regulatory items, associated wellness program implications, vaccine clinics, and employment law-related considerations around the vaccine. Our two presenters are Erin Powell and Valerie Faeth. Erin Powell is Seubert Associates Compliance Officer. She started her insurance profession at a national health insurance carrier and transitioned to an agent broker role in 2017. Her current role is our compliance officer at Seubert Associates, and she's been in that role since 2009. Erin is responsible for ensuring Seubert's clients maintain awareness of new developments and changes within various federal and state laws that may impact employee benefit programs, while helping employers meet and execute on those compliance requirements. Valerie is a shareholder at Dentons Cohen Grigsby Labor and Employment Department. During the 32 years that Valerie has been practicing law, she has represented employers in a broad array of employment disputes. Her areas of focus include conducting and overseeing investigations of alleged employee misconduct, counseling employers on hiring, disciplining, and discharging employees, defending employers in investigations conducted by administrative agencies such as the EEOC, PHRC, and DOL, and federal court litigation, providing supervisor and employee training on a variety of employment matters, and drafting employee policies, including drug and alcohol policies. Valerie has been selected by her peers for inclusion in the best lawyers in America in the field of labor and employment since 2013, and is a frequent lecturer on employment subjects. She currently serves on the board of the Blind and Vision Rehabilitation Services of Pittsburgh and resides in Upper St. Clair with her husband, Steve. So today, throughout the webinar, we are going to pause for questions as they aggregate around certain topics, and how you are able to submit those questions is through the message application on Zoom. We know everyone is very busy, and we certainly appreciate your time. So with that, I'm going to turn it over to Erin Powell, and she will begin the presentation talking about the coverage implications, vaccine clinics, etc. Thank you very much.
Thanks, Eric. I appreciate that. As Eric had mentioned, I'm going to handle the kind of health plan specifics of the vaccine, and then Valerie is going to hit upon those employment law provisions of vaccine implications. So what you're seeing here is just an overview of the vaccine. We now have 3 vaccines that are approved by the FDA for emergency use, most recently the Johnson & Johnson vaccine, and then also announced yesterday Merck is going to partner with Johnson & Johnson to manufacture that vaccine. So that is great news. We'll have more vaccines coming onto the market very shortly. Additionally, if you're interested in other vaccines that are coming our way globally, there is a link to a pipeline about all 19 vaccines that will be hitting the global market. So vaccine distribution, that is mandated by the federal and state governments. One thing that we did want to point out is a new tool by the CDC. It's at the link here, and that link will be available in the PowerPoint presentation available after the webinar. That vaccine finder assists in all states and includes vaccination location information for all 3 of the vaccines. But as you can see here, this is just an overview of the distribution guidelines by state. We focused on Pennsylvania, Ohio, and West Virginia. Again, all 3 states are using phases, and each phase within the states are a little bit different. Again, this is not the specifics, just a high-level overview, but if you did need additional information about vaccine classifications or where each state is at, you can select the link at the bottom of each state. So group health plan coverage, we have known since the spring of 2020 under the CARES Act that the COVID-19 vaccine would need to be covered under group health plans without any member cost sharing, and that new vaccines must be covered within 15 days of FDA approval. So this means that the new Johnson & Johnson vaccine that was approved at the end of February will need to be covered mid-March. Again, cost sharing is not prohibited, so that's any deductibles, co-pays, or co-insurance, or prior authorization or medical management. Again, those vaccines need to be covered by in-network or out-of-network providers. And a plan cannot deny coverage because a participant does not meet the state's current vaccination priority. So whatever phase the state may be in, if that person doesn't meet that phase, but they still obtain the vaccine, the plan cannot deny that claim. Also, a provider who fails to administer the vaccine because an employee or a patient fails to meet the current criteria cannot be submitted as an appeal or a claim denial under the group health plan. And those are new clarifications that the Department of Labor has issued in the past week. Wellness program implications. Again, we are still waiting for the Department of Labor, specifically the EEOC, to provide concrete guidance on how wellness programs should be treating the COVID-19 vaccination as far as rewards. A best practice right now would be to keep your reward if you are rewarding employees for getting the vaccine at a de minimis amount. And a de minimis defined by the IRS means insignificant. So an example would be a gift card or other small reward. A best practice is somewhere under $100 if you are giving a monetary amount. You would want to avoid an incentive that is too high that the federal government may deem your vaccination policy as mandatory. And another best practice would be that you allow employees who are unable to obtain the vaccine get that incentive by another means.
Hey, Erin, one quick question before you move on. As far as the who's paying for the vaccine, one of the questions we got is, I thought the government was paying for the vaccine.
If there is group health plan coverage, the group health plan would pay for the vaccine. If the person obtaining the vaccine does not have group health plan coverage, the federal government will pick up the tab on that.
Thank you.
On-site clinics, we here at Seubert, our clients have made many inquiries to us about providing employees a vaccine via an employer clinic on site. We're hearing good news that in the next few weeks that our wellness vendors will have additional information about obtaining the vaccine. They're hoping to get those vaccines fairly recently. However, the one key thing to keep in mind is that those state phase restrictions, eligibility guidelines would still need to happen within an employer vaccine clinic. And here we just have some considerations that you may want to think about if you're thinking about having a vaccine clinic at your place of employment. Again, those government eligibility restrictions, observation periods, setup, PPE, and again, if you're using the 2-dose vaccine, scheduling a second dose. And of course, tips for success. You want to educate your employees prior to offering the vaccine, information about the vaccine they will be obtaining. If you are having a vaccine clinic, you'll want to do that during working hours, or if it's not working hours, offered paid time for employees to receive the vaccine. This isn't a mandate. These are just tips and best practices. And of course, staggering employee vaccination schedules to avoid certain things. So with that, I'm going to turn the presentation over to Valerie.
Unmute. Okay. Good morning, everyone. Yes, okay. Good morning, everyone. I'm glad that so many of you are able to attend today's webinar, and I'm happy to see so many folks that I know, including some clients, are in attendance as well. As Eric mentioned earlier, I'm going to be talking about some of the legal issues that arise out of the COVID vaccines. But before I do so, I wanted to talk a little bit about the vaccine approval process, because I was thinking that this information might be helpful for you to share with employees who are afraid to get a COVID vaccine. As most of you are probably already aware, the FDA has authority and oversight over the safety and effectiveness and quality of vaccines that are used in the US. And the FDA only approves vaccines that it determines are safe and effective based on laboratory data and clinical trials. Generally, once a vaccine is developed and all of the clinical trials have been completed and the data studied, the company that created the vaccine applies for something known as a biologics license application. The entire process of securing a biologics license is quite lengthy and generally takes 6 3/4 years. Thankfully, I'm going to have to advance to the next slide. The FDA can grant emergency use authorization to a vaccine in a public health emergency, such as a current COVID-19 pandemic. The FDA has issued emergency use authorization, as Erin mentioned, for the Pfizer, Moderna, and the new Johnson & Johnson vaccines based on the following factors. Number one, COVID-19 is a life-threatening disease. Number two, the vaccine may be effective in treating and preventing the disease. Number three, the known and potential benefits outweigh known and potential risks. And finally, there's no adequate, approved, or available alternative. Now, despite the fact that the current vaccines were approved on an emergency use basis, it's important to realize that that does not mean that they were not subjected to rigorous testing. In fact, they were. All of the vaccines were given to tens of thousands of study participants to generate scientific data and other information needed by the FDA to determine that the vaccines are both safe and effective. All 3 vaccines underwent 3 phases of trials. Under the first phase, a small number of healthy people were vaccinated to determine that the vaccine induced an immune response. Under the second phase, more people with varying health statuses from different demographic groups were given vaccines to study their immune responses. And finally, in phase 3, thousands of people in randomized controlled studies were vaccinated. I also wanted to point out that the FDA can revoke an emergency use authorization, as it did with, and I hope this is a tongue twister, hydroxychloroquine, after the FDA determined that this drug was unlikely to be effective in treating COVID for the authorized uses in the emergency use authorization. The fact that the FDA has not revoked the emergency use authorization of the Pfizer or Moderna vaccine should be reassuring that the vaccines are relatively safe. Unfortunately, as Erin touched upon earlier, because there have not been sufficient numbers of vaccines available, Pennsylvania and some other states have been following a phased approach. And of course, as Erin had on her slide, Pennsylvania currently has 4 phases: phase 1A, phase 1B, phase 1C, and the final phase 2. Sadly, even though the number of available vaccines has increased over the past few weeks, Pennsylvania has not been doing a very good job getting vaccines in the arms of PA residents. In fact, based on a study published on March 2nd of 2021, Pennsylvania has only used 72.41% of the vaccines that were distributed to it and ranks 46 out of 50 based on the percentage of vaccines administered. This probably explains why PA is still in phase 1 compared to Ohio, which today entered their phase 1C. Hopefully now that the J&J vaccine has been approved, the rollout will pick up pace. On the slide, on the right now I'm showing this slide, it's phase 1A, and it's who you would expect to be included in phase A. It'd be healthcare professionals, all the people that work at hospitals, long-term care residents, adults over 65, and then of course, other individuals ages 16 through 64 with high-risk medical conditions. I have some of those conditions listed on this slide. It does not include obesity or having a body mass index of over 30, high blood pressure, and some other conditions. I just wanted to illustrate some examples on this particular slide. Under slide 1B, as Erin indicated earlier, individuals in certain occupations will be covered. And these are basically individuals that work in congregate settings, such as correctional officers, food and agricultural officers, U.S. postal workers, etc. Phase 1C is similar, but includes transportation and logistics employees, water and wastewater employees, food service employees, individuals that work for federal, county, and local governments, etc. In the final phase, individuals who were not previously eligible for vaccines, ages 16 and older, and who do not have any contraindication to getting the vaccines will be eligible. I did want to point out that at this particular time, only the Pfizer vaccine has been approved for individuals ages 16 and 17. Moderna has only been approved for individuals 18 or over. I also wanted to mention that Pfizer is currently running clinical trials on teens ages 12 and 15. Although the results of some of those trials will be available this summer, I think it's safe to say that the vaccine will not be approved anytime in the near future for teens. However, at least we're heading in the right direction in that regard. So I wanted to now turn to some of the frequently asked questions that I've received and my partners have received over the past few months. And probably the most frequently asked question is from employers is, can I mandate the COVID-19 vaccine for my employees? And the precise answer to that question is yes. Based on the EEOC's December 16, 2020 guidance, it's pretty clear that you can mandate it subject to certain limitations. And you may think, well, what are those limitations? Well, the limitation is the requirement must be job related and consistent with business necessity or due to a direct threat. So it would be very easy to establish that employees who provide direct care to vulnerable populations, such as individuals that work in hospitals or nursing homes, or work near one another in the public, should get vaccinated. But it would be an entirely different argument to claim that individuals who work in offices, their own individual offices, who rarely come into contact with the public, should be mandated to get vaccines. So again, if you're going to mandate it, you're going to have to meet the requirement that it's job related and consistent with business necessity or due to a direct threat. Sure, we're going to have some questions. Should I pause here? Eric, are there any questions that I should?
Not at this point. I guess my question is, like, as far as does business necessity refer to a category of jobs, or is that somewhat gray? And
it's really a case-by-case analysis. So, I mean, there are going to be certain classifications of jobs that I think clearly will fall into that bucket. And I think most healthcare providers, you could certainly make the argument. I mean, we've seen what happened at nursing homes over the past year, and it's been pretty horrific. So I think that you could certainly make the argument, if you were the owner of a nursing home, that all of your employees should be vaccinated because, the risk is too great that you'll infect the residents, and they're a very, very vulnerable population. But again, there would be some things that would be clear, but there'd be a lot of shades in gray, if that answers your question.
Sure does. Thank you.
Okay. Another question I've gotten from clients is, do I need to worry about the ADA if I'm going to require my employees to have the vaccine and I'm going to administer the vaccine? And the precise answer to that question is the ADA really doesn't come into play here because A vaccination is not a medical examination within the meaning of the ADA because it's not a procedure or test that seeks information about an individual's physical or mental impairments or health. Instead, it's given for the employee's own safety and maybe the safety of others around the person. And therefore, the administration of the vaccine is not prohibited or limited by the ADA. However, the EEOC in its guidance has made clear that the pre-screening vaccination questions may implicate the ADA because they are likely to elicit information about disability. Therefore, if you are an employer mandating the vaccine and administering the vaccine, you must show that the pre-screening questions that you're asking are job-related and consistent with business necessity. And how do you do that? Well, you would want to make certain that the questions you're asking only solicit information necessary to determine if it is safe for the employee to get the vaccine. Therefore, it should be a very narrow set of questions, such as, have you had allergic reactions to drugs in the past? What reactions have you had? What drugs caused the condition? Have you received a vaccine already? What type of vaccine? Things of that nature. However, there are some exceptions to this rule. If you do not have to, as an employer, satisfy the job-related and consistent with business necessity requirement if you're offering the vaccination on a voluntary basis. Further, you don't have to meet this requirement if the employer required vaccination is from a third party that does not have a contract with the employer, such as a pharmacy or another healthcare professional.
Valerie, we got a couple questions that came in. I
Sure.
wanted to just pause here for a second.
Yeah.
So in regards to like the business necessity of mandating a vaccine, is it on the employer to make that determination, or how
It is on the employer, right?
Okay. And then the second question that came in was, can organizations record and store employee information on who has had the vaccine? So can they say, hey, I know that 75% of my employees have it, and they record who says they took the vaccine?
Yes, in fact, I was going to cover this in a later slide, but the EEOC in the recent guidance made very clear that you can ask employees if they've had a vaccine. Now, there is, of course, an exception or a little nuance. If you ask them why they did not have the vaccine, you could be running afoul of the ADA because that could be considered a medical question. And so you have to be careful about that. But you can definitely ask employees, have you gotten vaccinated? And you could keep a record of that. I would recommend that it be kept separate from personnel records and, kept under lock and key because it's confidential information. But you absolutely can ask your employees if they've been vaccinated.
Yeah, I think this is kind of along the same lines, but as far as like mandating employees that they report that they got a vaccine, it's the same kind of question, right? In a sense.
Yeah, I mean, I would think, my understanding is everyone's going to get a card. And I think honestly, this issue may take care of itself, because I think if anyone wants to travel out of the country, they're going to be required to show that they have a vaccination card. So I think ultimately, even people that are reluctant to get the vaccination now will ultimately get it. But I think that simply asking the person, why not go the step further and ask for proof of vaccination? I think that would be perfectly acceptable.
Okay, I have one more for you, Valerie, before
Sure.
we move on. And I think it goes back to the business necessity of office worker type employees, where you're really saying you can't mandate that, even if the rationale is like for the safety of your coworkers.
Well, it would depend. I think you could make the argument, if there was a communal kitchen, if they have frequent interactions, but you would really have to drill down and do a factual analysis to determine if you had a basis to mandate the vaccine. I think it's a harder argument in that type of setting for an office worker than it is in other settings. And the other thing that, you know, if someone were to file a charge and say you didn't have there was no business necessity to you mandating it, they would look at were there other avenues that the employer could have taken, such as social distancing, masking, things of that nature.
Okay, thank you.
Okay, so I'm going to move on to the next slide. Like anything in life, there are certain exceptions. Oops, I can't advance it. That's weird. Josie, what's going on? Okay, there we go. Of course, there are some exceptions to mandating vaccines. An individual could basically say, hey, I have a disability that prevents me from getting the vaccination, or I have a sincerely held religious belief, and therefore I'm not going to get the vaccination. And in those instances, you as an employer, someone's raising their hand. I have a lot of questions here. To advance the slide again. Is Josie available? Okay. If an individual indicated they did have a disability, you could ultimately preclude them for the workforce if there was no accommodation that could be made to eliminate any threat that they would create. And but I think in most cases, there could be accommodations unless you were in the setting of a nursing home or a hospital where it would be hard to eliminate the risk. And I think the argument is pretty hard to make that you can accommodate someone if the person has been working remotely pursuant to Governor Wolf's current order that says you're to work remotely unless impossible to do so. You know, you may mandate that people come back to the office, and this individual may say, hey, you have this mandate that we get a shot. I can't get it. I have this autoimmune condition that precludes me from getting it. I think in that case, you may have to consider allowing that person to work remotely, at least until it becomes safe for them to return to the workforce without a vaccine, if you determine that it was unsafe for them to work in your environment without a vaccine. So I'm going to move to the next slide. I think there are a lot of questions. Again, another exception, if an employee has a sincerely held religious belief or practice, you might have to provide an accommodation unless doing so would result in undue hardship. Undue hardship under Title VII, which covers requests for religious accommodations, compromises would be if it was costly, compromised workplace safety, decreased workplace efficiency, infringes on the rights of other employees, or required employees to do more than their fair share of hazardous or burdensome work. So in the case of someone asking for a religious accommodation, you may request additional information if there's an objective basis for questioning the individual's religious refusal or sincerity of their belief. However, that's somewhat of a slippery slope. I think normally you should assume that the belief is legitimate, and you should not haphazardly question the employee or call their place of worship. With that said, I did want to point out that a genuinely held belief does not pertain to someone's political views that the vaccine should not be required, nor does it pertain to their fear of getting the vaccine. So if someone's saying, I'm not going to get the vaccine, I've read things on YouTube that I'm going to be implanted with a chip, I'm not getting it, they would not be protected under Title VII. Or if they were fearful, again, they would not be protected under Title VII. Again, they would have to have a sincerely held religious belief that would preclude them from getting the vaccine.
All right, Valerie, I have a couple questions in regards to how this falls under the mandate. And the
Sure.
first is allowing or asking for the employee for a copy of their vaccination card.
So I'm not sure what the question is. Is it?
As far as like in regards to the mandate, and as far as tracking if an employee received the vaccine, are you allowed to ask them for a copy of their vaccination card, or are you just simply asking them, did you get it or not?
I think that it's perfectly acceptable to A, ask them if they got it, and B, also ask them for a copy of the card. Either or, you could do both. I think the EUC in its guidance made very clear that this is not, it does not infringe on any laws to make this request. It's not a medical inquiry. It's simply an inquiry, did you get the vaccine? So it is allowed.
And then like, I'm sure there, as far as the not mandating it, if someone's pregnant, I'm not a doctor, but it's unclear if it can be required or not. But after someone has the baby, is there any guidance at this point as far as like, let's just call it a grace period per se for having an employee get vaccinated if they had a baby, and how long after?
Yeah, that's a good question. I think we don't have enough data right now to really make any kind of decision, but I think it would be perfectly acceptable. If someone was breastfeeding, you don't really know what effect, if the person was, if you demanded that as soon as they have the baby, they get vaccinated, you don't know if that drug would get into the baby through breastfeeding. So I think it would be acceptable to have a grace period. Again, there's no guidance on that, but I do think that there's certainly medical literature that suggests that, there have been some clinical trials. They think the vaccine's safe for pregnant people, but I would be very hesitant as an employer to mandate that someone that is pregnant or just had a baby get a vaccine. And in fact, I think it's premature for anyone to mandate a vaccine other than a hospital or a nursing home, because we simply do not have enough vaccines available to vaccinate everyone.
Right. Question came in, Valerie, on like the physical setup of an office with the business necessity. So like the question is, there's an open office plan, right, where there's a cafeteria, doesn't sound like the desk or space far apart. Would the physical setup of an office be deemed a reasonable criteria for mandating a vaccine?
It would certainly be a consideration. If it was an open space, it would be costly to change that around. And people congregated together. I think the argument could be made that there was some business necessity to mandating the vaccine.
Thank you. And I think I know the answer to this question, but as far as the documentation for the vaccine that an employee would give to the employer as proof that they're vaccinated, is the vaccine HIPAA protected?
I do not believe that it is HIPAA protected. I mean, I guess it is a medical record given by, some type of clinic, but I think, again, the HIPAA applies to the entity that provided the card. The HIPAA regulations don't apply to the employer, so I think, again, I would keep it in a file. I would consider it kind of confidential medical information, but I don't think that there are any HIPAA implications for an employer.
Got it. And then this is a good one, because we have a lot of clients who have different groups of employees or departments where field and service, customer service, whatever, that they travel throughout the US or overseas. So like based on their job type. So whether they're traveling within the US or overseas, like, can it be, mandated for certain groups of individuals and not necessarily the other, based on how those individuals work or interact with other people?
Absolutely. In fact, the EEOC in its guidance suggested just that. Now, I think it would be difficult in a hospital setting to say, okay, the people that work in the billing department are not going to be required to get vaccinated, but everyone else is, because again, it's conceivable that people in the billing department would use the hospital cafeteria, and because there are a lot of people in hospital settings, it could spread. But in the instance you're talking about where you have different departments and people do very different things, and maybe they're different locations, I think it would be completely justifiable. And the EEOC has suggested just that. Instead of having this blanket policy, again, look at what different people do, what their job duties are, et cetera. And again, going back to your point, if someone's required to travel overseas, I think from what I understand, they're going to be required to present a vaccination card to even go overseas. So again, you might not even have to mandate it. Well, I guess you would have to mandate it because it would be an essential job duty. But I think people are going to want to keep their jobs and they're going to volunteer to get those vaccines.
Great, thank you. One more before we move on. So there's
Sure.
every individual situation is unique. Say I'm younger, I'm married, and me and my wife are planning to have children, and we're skeptical about the lack of information at this point about the vaccine. Can you make exceptions to individuals based on an example like that?
Actually, that person would not be protected. As I kind of went through, if you have a fear, if you have concerns, you're not protected by Title VII, you're not protected by the ADA. If the person had a disability, that would be one thing. If they had a genuinely held religious belief, that would be another thing. But no, I don't think if you had a mandate that you should be making exceptions for someone under those circumstances.
Okay, thank you. We do have some other questions in regards to the mandate, which we will get back to. I just want to make sure Valerie gets through her presentation, but we're counting those questions and we'll address them if there's time at the end. If not, we will follow up with them. Thank you.
Okay, thanks. So again, when you're looking at whether or not you can accommodate someone, even if you conclude that you cannot, you also have to consider whether or not there's a direct risk. And so the direct risk would be the duration of the risk, the nature, the severity, the likelihood and imminence of potential harm. I think this becomes kind of a hard analysis as time marches on and more people are vaccinated and maybe there's herd immunity. Is there really a huge risk if one person that's not vaccinated comes, basically wants to continue to work for you and maybe they have a disability or they have a religious belief, you're going to have to prove that they can be excluded because you can't mitigate the risk of them coming back to work. So I think that's a pretty high burden. It'll be interesting to see how this works out. Let me go to the next slide. Okay, so we talked about this a little bit. Again, you are allowed to ask for proof of vaccination. This has been a frequent question I've gotten. The EEOC has made it abundantly clear in its guidance that asking a person if they've been vaccinated is not a disability-related inquiry. For that same reason, I think it's perfectly acceptable to ask an employee for a vaccination card. Again, I don't think that would be covered by HIPAA. The entity providing the card is covered by HIPAA, but an employer getting a copy of the card is not covered by HIPAA. However, I did want to point out that you need to be careful about asking an employee why he or she did not get the vaccine unless you have a job-related reason for asking that question. So, because again, if the person may say, I have an underlying medical condition, and that would basically be a medical inquiry under the ADA. So again, you may want to ask people, and then if they tell you they have a disability or genuinely held religious belief, you are going to want to drill down further. Certainly with the disability, you're going to want to engage in the interactive process. You may want to ask for some evidence that they have an underlying medical condition. You're going to want to explore ways around, excluding them from the workforce if they do have a disability. One question I have received from several clients is because the FDA requires that employees or individuals getting shots receive a sheet about their right to refusal of the vaccine because it's because of the emergency use authorization, there's kind of a misconception that that means an employer cannot mandate the vaccine. And that it is a misconception, because the right of refusal that's in the FDA sheet that's given to people when they get the vaccine really pertains or relates to whether an individual can be forced to take a vaccine by the government. It does not pertain to an employer's right to condition continued employment on an employee taking a vaccine. However, again, an employee whose employment is terminated because of his or her refusal may ultimately sue under some public policy theory. I think it's unlikely, but that's a potential. But I have had several clients say, well, you can't mandate it because of the FDA regulations. Again, the FDA regulations really pertain to whether the government can force the vaccine, not on an employer's right to condition continued employment on the vaccine. I also just wanted to mention, this popped up the other day in my emails, that there is a House bill. It's still pending. I don't think it's going to go anywhere. Republican Representative Russ Diamond introduced this bill that basically would make it illegal for an employer to fire, threaten, terminate against, or discriminate against employees who refuse to receive a vaccine, and would allow employees who were suffered an adverse job action for refusing a vaccine to gain reinstatement, triple damages, etc. Again, I don't think it's going to go anywhere. It is opposed by the PA Chamber of Business as well as the Hospital Association of PA for obvious reasons. I think it's bad for business. I don't think it's going to go anywhere, but I did want to let you know that I just learned about this bill and it is still pending.
Valerie, I got a couple interesting questions here. So
Sure.
Basically, if an employer hires an individual, which requires them to interact with another entity, right? And let's just call that a university, which in that university requires that a vaccine and that employee refuses to do that. Do you bucket that under the disability or religious beliefs, or how do you try to accommodate that situation?
So the person doesn't have a disability or religious belief,
we're just saying that refuses the vaccine for whatever reason. So I'm assuming.
Yeah, in that case, you could exclude them from the workforce, or you could terminate that person. If it was I mean, clearly they couldn't perform the essential duties of their job if it was to interact with these other people. But again, they wouldn't be protected under Title VII or the ADA based on the scenario you presented. I guess a more interesting question would be, what if they had an underlying disability, couldn't get the vaccine, and the job that they're supposed to be performing required interaction? Then you would have to see whether there was any type of accommodation. And if there was no accommodation that could be made, you could basically terminate that employee.
Yeah, and then finally, there's the flu vaccine been around for a while, and I feel like employers provide a venue to get the flu vaccine. Now with the COVID vaccine, and the word mandate can be used under the circumstances you described. How are the other vaccines that are in our world today, not under this same bucket?
Well, again, the reason why the EEOC in its guidance has suggested, it doesn't say directly, has suggested that you can mandate it, is we're in a public health emergency. So this is an unprecedented time, hopefully never to be repeated in the future, but we're under very unusual circumstances. I do know that some employers do mandate the flu vaccine, again, based on business necessity. If they're a nursing home or hospital, they can mandate that their employees receive the vaccine. So, I mean, I think there are other vaccines that, again, they don't require, I know like a tuberculosis vaccine, I think that's required of nursing homes and hospitals as well. So again, it depends on the environment, in which the person works. Am I making any sense? I might be going too far afield from the question.
Yeah, I think that's addresses it at a high level, but if there's a follow-up needed, we can certainly address it. Thank you.
Sure. Okay. Another question that I've gotten from some of my clients is, if I don't mandate the vaccine and a bunch of people are infected, am I going to be fined by OSHA? So I wanted to point out, first of all, that OSHA did publish new guidance on January 29th of 2021, and it does not mandate the COVID vaccine. However, it encourages employers to make vaccines available at no cost, to provide information and training on the benefits and safety of the vaccines. So I think if, would OSHA fine you because you did not mandate the vaccine and someone got sick? I think it's very unlikely based on the new guidance. However, over the past year, I know that numerous clients of ours have been fined by OSHA because they've had outbreaks of COVID because they haven't provided the right PPE and done what they needed to do to protect their employees. As you know, under OSHA, there's a general duty clause that you're supposed to, an employer is supposed to provide a safe workplace for its employees. But so far, no one is interpreting that as mandating that employers have everyone vaccinated. Another question that I've received even more frequently than the OSHA question is, what is my liability if I mandate the vaccine and the employee that I've mandated gets the vaccine gets sick? So I think there's some good news generally if your employee would get sick from the vaccine, and they missed enough time from work, they needed medical treatment, they're going to be covered under the Pennsylvania Workers' Compensation Act, especially if you've encouraged them to get the vaccine. And, maybe, regardless of whether you offer on site, if you offer on site, I think it's more than likely going to be covered under comp. But if you've encouraged people, you derive the benefit of having this vaccinated workforce, I think the argument could be made that workers' comp would apply. There's also something called the Public Readiness Emergency Preparation Act that would also protect or shield employers from liability from any tort liability claims. So again, I think so far I haven't had a single client that has called and said, I'm in trouble with someone's trying to sue me because they got sick because I encouraged them to get the vaccine. But again, workers' comp, and then you have the PrEP Act as well as some protection. So my recommendations, and I think these mirror some of the recommendations that Erin made earlier, is that you should consider encouraging rather than mandating vaccines. And as I indicated a little earlier, I think it's premature to mandate because there simply are not enough vaccines. So how can you mandate if the person wasn't eligible, like for instance in PA? So I think the better course of action would be to encourage vaccinations through education and communication. You might want to consider giving your employees some flexibility during the workday to get a vaccine and paying them for their hours away. I know that Trader Joe's, I saw an article where they offered their employees 2 hours of pay for each vaccination. You also might want to consider offering employees a few days of paid leave if they get sick following the vaccination. You could consider offering the on-site vaccine clinic, but understanding, again, you have to be careful about the medical questionnaire. We've talked about that a little bit earlier, and that any questions that are asked are very narrowly tailored to fit business necessity. One thing I've done with some of my clients is kind of put together a memo to give the employees and provided links to all of the sites that offer vaccines. One of the obstacles that some of my clients are finding is some of their employees are older and they don't have the requisite computer skills. Some of them don't even have a laptop. So I've encouraged the employers to help them with signing up for vaccines and helping them, on the computer, locating vaccines as well. Let me see. I think it's also good to confirm and explain to employees how their healthcare benefits will cover the vaccination cost. Some employers are even covering any copay cost. I think it's important to clearly communicate that the employee's health and well-being is a top priority. I know some of my clients have said, well, what if we penalize employees who don't refuse a vaccine? I think that's a bad idea. I think that you should, again, make it a more positive rather than a negative issue. And you also might want to consider adding verbiage to your handbook about COVID vaccines when appropriate, that it's a requirement. So I think I'm going back to Erin now.
Thank you. I think that was extremely helpful for a number of questions that we've received here at Seubert and are unable to answer due to that employment law nature. Finally, just to wrap things up before we get to any last questions, are additional COVID-19 compliance items that are coming down the pike, just to give you guys an overview of some things that we are seeing. EEOC wellness regulations, they were previously issued under the very end of the Trump administration and then removed, and then they will most likely be reissued in the very near future. We expect that there would be clarification on vaccine-related incentives or penalties within those EEOC regulations. Last week, the Employee Benefit Security Administration issued a disaster relief notice. Under the CARES Act, a number of group health plan deadlines were extended or delayed due to the public health crisis, and that deadline was set to expire at the end of February 2021. They have now extended that relief. Especially this comes into play with those COBRA deadlines for enrollment and or payment of COBRA premiums. And the extension would work 1 year from the date that the employee was first eligible for the relief, or 60 days following the announced end of the outbreak period. So for example, if I had a COBRA qualifying event in June of 2020, I would have 1 year to June of 2021 under that relief, unless the public outbreak period ends sooner. So we just wanted to make our clients aware of that. And then finally, the next stimulus plan currently passed in Congress by the House under review by the Senate is the American Rescue Plan. And that includes, in the House version that was passed, subsidized COBRA premiums. The federal government plans on picking up 85% of the COBRA premium. That would need to be fronted by employers, and then employers would get that premium back via tax credits. And additionally, the Families First emergency FMLA paid leave that became optional for employers on January 1 had extended tax credits until March of 2021. Those tax credits would be extended till September. So just a few things. Obviously, we will clarify as soon as the American Rescue Plan is finalized and signed by the president.
Okay, I do have a collection of questions here we're trying to get through here quickly before the hour's up. I believe this one's for Valerie. And the question is, Valerie, are there any problems legally or ethically with requiring staff to get a vaccine in order to have less restrictions for some in-person events? And it appears to be in a ministry, and it's like, can you do that for a period of time?
Right, that's a really great question. Yes, I think that you could make the argument if there were going to be, part of the mission was to have these meetings with various others in congregate settings, that there was some business necessity to mandating it. Again, that could change over time after the COVID pandemic is over. You know, maybe you could make the same argument like this time next year, hopefully, that there's a real reason to have it. We just don't know right now, you know, is this going to be an annual thing that you need to get? We don't know how long the antibodies last. But yeah, I think that would be, you could make the argument certainly under that scenario.
Thank you. And then, you know, we have people who go out and get the vaccine on their own if they're in 1A and in PA. And say that employer who doesn't mandate a vaccine says, hey, we'll give you the 6 days because of the effects of getting vaccinated. If an employer offers sick days or paid leave in order to either get the vaccine or recover from the vaccine, is that employer opening themselves up to any risk, specifically a workers' comp claim, by allocating 2 days leave per se for a vaccination?
Yeah, I mean, potentially, I really don't think that that's the most important factor. I think the factors would be, are you encouraging your employees to get it? So I guess that is a form of encouragement. Like if you do get sick, go get it. If you get sick, we're going to cover you. So again, that would be a factor that would be considered whether or not, it should be a workers' comp cover thing. I mean, certainly if the person, if the employer is offering on site, I think it's going to be covered under workers' comp, if someone gets sick for a period of time or needs medical treatment. If it was offsite and they just said, hey, we'll pay for these days, I think the argument could be made. But again, I have yet to see a single comp claim arise out of somebody getting a vaccine.
Okay, thank you. 2 final questions, unless some come in, is an employee refuses to get a vaccine, doesn't have any exemptions. Are you able to terminate that person?
Again, is this a situation where you've mandated the vaccine and you have business necessity reasons for mandating it? In that case, yes, you could, if they refuse to get it and didn't have religious belief or disability, yes, you could terminate that person. Again, that's provided that there's some risk that they pose and there's some business necessity to asking them to have the vaccine.
I think the last 2 questions here, the ones around like this, I think it's based on the state, but let's just say once an employer, all these vaccines start to become available, an employer sets up a vaccine clinic, it's on site, and they encourage it and they do all the right things or best practice that you and Erin described. Is there a point where they can certainly lessen the PPE or mask wearing if they post something along those lines that a clinic is being hosted? I guess it's, at what point can an employer choose to lessen PPE?
Yeah, I mean, that's a good question. I think employers should continue to follow the guidance from the PA Department of Health, which usually tracks what the CDC is recommending. So as of right now, I don't think anyone's saying you can stop wearing masks. I know they're opening up indoor dining, they're opening up certain businesses, but right now, again, if you're following the Department of Health regulations or orders and the CDC, again, we just don't know. I would be following what their recommendations are. I don't think I would just decide as an employer, hey, everyone's been vaccinated, stop wearing a mask, because what if people are carrying it, even though they've been vaccinated, a bunch of people get sick, and then it comes to light that you haven't been complying with the orders, then I think you could be subject to an OSHA violation, right?
One other quick question, and then we'll conclude the webinar and address any questions that we did not get to. I think I tried to get to most, or not all of them, but if an employee asks for time off to travel to go another state to get the vaccine, Valerie, you and I were talking about the access and availability in Ohio this morning. Is there any liability for allowing them to take time off to go get a vaccine in Ohio, per se?
I don't think so, but let me just point out, my understanding is you just can't go across border to get a vaccine because they're going to be asking you for your driver's license. And generally they're reserving the vaccines for the state in which you live or reside. Okay,
thank you. So I want to thank everyone who joined the webinar today. This was recorded and we will distribute it. We will comb through the questions and send out a Q&A after this for anything we didn't address. But I also wanted to thank Erin and Valerie for the time that they put into putting this webinar together. I know there's a lot of webinars out there, but this was directed based on specific questions that we were getting. So Erin and Valerie's contact information is on the last slide, but will also be included in our follow-up materials from this webinar. So with that, Thank you, everyone, and have a great day.
Bye, everyone.